Do you know about COPD, also known as chronic obstructive pulmonary disease, and how to prevent it? This common yet often misunderstood respiratory condition has a significant impact on millions of lives worldwide. COPD is a lung disease characterized by chronic obstruction of lung airflow, making it hard to breathe and leading to symptoms like coughing, wheezing, shortness of breath, or chest tightness. But here's the key thing to remember. Unlike many diseases, COPD typically has a clear cause and a clear path of prevention. The majority of cases are directly related to cigarette smoking. Yes, you heard that right. Smoking is not just about risking lung cancer. It's also the leading cause of COPD. So one of the best ways to prevent COPD is to never light up a cigarette, or if you already have, to stop smoking now. It might sound simple, but we know it's not. That's why we're here to help. In the next few minutes, we will explore effective ways to prevent COPD and slow down its progression. The best prevention method for COPD is simple yet challenging: to never smoke or to quit smoking now. The relationship between smoking and COPD is as clear as the smoke from a lit cigarette. It's strong, direct, and unfortunately detrimental. Cigarette smoke is a cocktail of harmful substances that, when inhaled, can cause significant damage to the lungs. Over time, this damage can lead to the development of COPD. Now, if you're a longtime smoker, you might think, easier said than done, and you're absolutely right. The journey to quit smoking can be a steep uphill climb, especially if you've been smoking for years and have tried to quit once, twice, or many times before. But here's the thing, it's a climb worth taking. Every step you take away from smoking is a step closer to better lung health. It's a step closer to reducing your risk of developing COPD. And even if you already have COPD, quitting smoking can slow down the progression of the disease. So how do you start this journey? The first step is to acknowledge the challenge. Quitting smoking is not a test of willpower. It's about breaking a powerful addiction. And like any addiction, it requires support, patience, and often professional help. That's where tobacco cessation programs come in. These programs offer tools and resources to help you quit smoking. They provide support, education, and sometimes medication to manage withdrawal symptoms. They understand the struggle and they're there to help you through it. It's important to remember there's no one-size-fits-all approach to quitting smoking. What works for one person might not work for another. It's about finding what works for you. It might take some trial and error, but every attempt is a step in the right direction. In the end, the goal is to quit smoking for good. It's your best chance at reducing the damage to your lungs and preventing the onset or progression of COPD. Quitting smoking is critical not only to prevent COPD, but also to reduce the damage already done to your lungs. Another risk factor for COPD is occupational exposure to chemical fumes and dusts. That's right, your very job could potentially increase your risk of developing this chronic lung disease. Let's delve a little deeper into this. Imagine you're an artist working with paints and solvents daily, or a construction worker surrounded by dust and debris. Maybe you're a miner, exposed to coal dust, or a textile worker inhaling cotton or flax dust. These are just a few examples of occupations where you might be exposed to lung irritants on a regular basis. Now, you might be thinking, well, I've been working in these conditions for years and I'm just fine. And you might be right. But it's important to remember that COPD often develops slowly over many years, so symptoms might not become noticeable until significant lung damage has already occurred. So what can you do about it? Well, it's not always possible to switch jobs or completely avoid these irritants, but there are safety measures you can take to reduce your risk. The first step is to have a conversation with your supervisor. They should be aware of the risks associated with your job and be able to provide you with the necessary protective equipment. Now, this might look different depending on your job. For some, it might mean wearing a mask or respirator to filter out dust and fumes. For others, it might involve using ventilation systems to remove harmful substances from the air. It might also mean taking regular breaks to allow your lungs some fresh air and respite from the irritants. And remember, these protective measures aren't just for people who already have COPD. They're for everyone who works in these conditions, because prevention, as they say, is always better than cure. So let's not underestimate the power of these seemingly simple measures. They might seem like a hassle now, but they could save you from a lifetime of breathing difficulties and health complications associated with COPD. In a workplace environment, protecting your lungs is crucial to prevent COPD. Now, let's discuss steps to prevent complications associated with COPD. First and foremost, if you're a smoker, it's time to put out that cigarette for good. Quitting smoking is the single most effective action you can take to reduce your risk of heart disease and lung cancer, two major complications associated with COPD. This might seem daunting, especially if you've tried and failed to quit before, but don't lose heart. There are numerous tobacco cessation programs available that can help you kick the habit for good. Remember, persistence is key. Next on the list is vaccinations. Having COPD can make you more susceptible to infections, which can in turn exacerbate your symptoms. To fortify your defenses, it's important to get an annual flu vaccination and regular vaccination against pneumococcal pneumonia. These vaccines can help reduce your risk of these infections, keeping your lungs healthier in the process. Lastly, mental health is an important aspect of managing COPD that often goes overlooked. The physical toll of COPD can often lead to feelings of sadness and helplessness, which can spiral into depression if left unchecked. If you're feeling low, don't hesitate to talk to your doctor about it. There are resources available to help you cope with these feelings, and your doctor can guide you towards them. Remember, you're not alone in this journey, and there's no shame in seeking help. These steps may seem simple, but they are incredibly effective in preventing complications associated with COPD. From quitting smoking to staying up to date with your vaccinations and keeping an open dialogue with your doctor about your mental health, each step plays a crucial role in managing your condition. Taking these steps can greatly reduce your risk of COPD complications. Remember, proactive prevention is your strongest weapon against COPD. So let's put these steps into action and take control of your health today. In summary, prevention of COPD is largely within our control. The journey we've taken today has highlighted that the power to prevent this disease and slow its progression if it's already part of your life lies primarily in our hands. The choices we make every day can greatly impact our lung health, and it's essential to be mindful of these decisions. Let's take a moment to revisit the key takeaways from our conversation. First and foremost, the most significant risk factor for COPD is cigarette smoking. While it might seem daunting, especially for those who have been smoking for years, quitting is the most effective way to prevent COPD or slow its progression. It's not about how many times you've tried to quit before. It's about finding the right support and resources to help you quit for good. The journey to a smoke-free life might be challenging, but it's one worth taking for the sake of your lungs. Aside from smoking, we also learned about the risks associated with occupational hazards. Exposure to chemical fumes and dust at the workplace is another contributing factor to developing COPD. It's crucial to have open conversations with your supervisor about the best ways to protect yourself. This could mean using respiratory protective equipment or implementing other safety measures. Remember, your health should always be a priority. Moving on, we talked about the steps to prevent complications associated with COPD. It's not just about prevention, but also managing the disease if it's already a part of your life. This includes quitting smoking to reduce the risk of heart disease and lung cancer, and getting regular vaccinations to ward off infections. Moreover, mental health is just as important. If you're feeling down or helpless, don't hesitate to reach out to a healthcare professional. It's okay to ask for help. In conclusion, preventing COPD and managing its progression is a multifaceted approach. It's about making healthy choices, from saying no to cigarettes to safeguarding yourself at work, and taking care of your physical and mental health. It's about making small, consistent changes that add up over time. And remember, even if you've been diagnosed with COPD, it's not the end of the road. There are ways to manage the disease and improve your quality of life. It's all about being proactive, staying educated, and taking the necessary steps to protect your lungs. Remember, it's never too late to make changes that can improve your lung health. Let's breathe easy and live healthily.